Welcome back to my channel in English for Nursing Communication 2. So I am Ruffel Manalo from the Faculty of Nursing Nakhon Pathom Rajabhat University. So we are now in Unit 6 of this course, Concept of Writing in Nursing Part 3. So once again, this is a team teaching course taught by the three of us from the Faculty of Nursing Nakhon Pathom Rajabhat University. So we have discussed a while ago in the previous videos that we have these 4 major objectives in this subtopic. And at the end of the lecture, what are you going to do? You have to review the concept again and again and design a nurse's note based on the case study, then submit to the lecturer's email. So once again, review all the details before doing so, because these details would somehow help you on how you are going to make your homework. So I will discuss to you. Okay. So the 5th objective of this course in writing a nurse's notes, we have this one, SBAR. Are you familiar of SBAR? SBAR. So SBAR in writing nurse's note. So in this topic, SBAR is a communication tool that provides a method of clearly communicating the pertinent information from a clinical encounter. So these encounters, these experiences, you get this from where? From the hospital, where you are interacting or caring with your patient. So let's find out what is the meaning of each letter, of each abbreviation from these details. So SBAR, S-B-A-R. So first, letter S. S stands for situation. So you could consider what is happening now. Okay, so it's very important. What is happening to your patient at the moment? That is S, situation. Second, B. Okay, B. B is background. So what are you gonna write in your nurse's notes? According to your patient's background, you have to write what has happened in the past, which is very, very relevant to the current condition of your patient. A. A stands for assessment. Okay, A stands for assessment. So what is the problem, or what is the issues that you have observed objectively, subjectively from your patient. R. So what is R? R means the recommendation. Okay, what you think needs to happen now to your patient? What does the receiver want you to do? What does the patient needs from you to do in the present time? So SBAR or SBAR, situation, background, assessment, and recommendation, is a tool, communication tool that provides a method of clearly communicating the pertinent information from a clinical encounter with your patient and their conditions. So in writing nurse's notes, so when you say writing your patient's Alright, so let's discuss in details what those abbreviations mean, okay, or means to say. S, which we have discussed, stands for situation. So what is happening now? What is happening to your patient at the moment? So what are you gonna do? Identify yourself and the site you are in. Identify the patient by name and the reason of your report. You have to describe your concern to the patient. Importantly, describe the specific condition about which you are assigned, including the patient's name, the consultant or the doctor of the patient, the location of the patient, the resuscitation status, and vital signs of your patient. So those are the inclusions, the details that you need to write in nurse's notes based on the situation that you see or is happening at the moment. B, okay. We have previously mentioned that B stands for background. What has happened in the past that is very important to the current situation of your patient. So as a nurse, you have to give the patient reason for admission. Okay, explain significant medical history, overview of the patient, background, admitting diagnosis, date of admission, prior procedures, current medications, allergies. Okay, allergies. You have to identify allergies because this is very important. Some patients may have bad allergies to food. Some patients may have bad allergies to medicines. Then pertinent laboratory results and other relevant diagnostic results. So for this, the nurse needs to have collected information from the patient's chart, flow sheets, progress notes, and other um, documents inside the patient's chart. So A, okay, previously we discussed A stands for assessment. So what is the problem of the patient? Um, how do you view in your own perspectives, subjectively and objectively about your patient's condition? So what are you going to do? You need to determine the vital signs, the clinical impressions, concerns. A nurse should think critically. Okay, take note of this. A nurse should think critically when informing the doctor of the assessment or the situation. The underlying condition of a patient depends on the nurse. So the nurses are very essential workers in the field of what? Patient care in the hospital setting. So the patient depends on the nurse. If the nurse is certain about the condition, it is safe to reason out that you are not sure about it and you are worried about it. So the nurses are the backbone of a hospital facility. Without the nurses, the hospital cannot operate. Okay? So that's A, which is assessment. R, recommendations. So we have previously discussed that R stands for recommendation. So what do you think is the need of the patient? What do you think you need to do to the patient? Okay, because your patient is your client. So you have to explain what will you do as a nurse, and it should be on a specific uh, time frame. Okay, so if the patient is sleeping, you don't have to disturb the patient. If your patient is not comfortable to talk about, so you give time. Okay, you have to be specific in your request because some patients don't feel very well while they are in a hospital. You also have to make suggestions not only to the patient but as well as to the significant others or relatives or next of kin of the patient in the hospital. You have to clarify expectations. So you don't have to explain this only to the patient but also to the rest of the family members present with the patient in the hospital. And importantly, as a nurse, okay, what will you recommend? Okay, what will happen at the end of the report between a nurse and a physician on orders that means accuracy of the information. So if you have accurate data from the patient, everyone will benefit it, not only the nurse but as well as the doctor because the doctor orders treatments and the nurse will be the one to carry out those procedures. So to conclude, okay, once again, writing summarizes the main points and draw ideas that are interrelated in the assessment, diagnosis, planning, implementation, and evaluation of patients using the step-by-step process. So this is what you're going to do. You have to design a nurse's note based on the patient case study that I'm going to give you. And this is about a case study that you need to be use that you need to use, I should say, that you need to use as a basis of making a nurse's notes. A 56-year-old male patient came to the outpatient department due to dizziness and headache. Upon assessment, the nurse checked his blood pressure or BP 150 over 95 millimeters of mercury and glucose test 200 milligrams per cent. So what do you think the patient is? Diabetic, and the patient is hypertensive in this scenario. So the patient has been diabetic for 5 years, hypertensive, smoker, and obese. The attending physician advised him for further investigation for at least 24 hours but opted to go home. So you need to base your nurse's notes from this case study and use this, okay? Please use this format. So only use this format that I am going to give you towards the end of the lecture. So thank you very much. If you have any inquiries, you can send me a message through my email, line, or messenger. So this is all. Have a nice day. See you next time.